I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar. Let's talk about atypical lobular hyperplasia and whether or not it needs to be removed surgically. Atypical lobular hyperplasia means that there are abnormal cells and too many of them in the lobules, or the milk-producing units of the breast. It often looks like this on a mammogram, or calcifications, these tiny white dots that you can see, but sometimes can present as a mass or as focal asymmetry. In the past, we removed these surgically because we felt like they could potentially turn into cancer, but we now know that atypical lobular hyperplasia does not turn into cancer, but it does slightly increase breast cancer risk. This is a meta-analysis published in December of 2024, and it looked at how much increase in breast cancer risk you can expect from a diagnosis of atypical lobular hyperplasia, as well as all of these other high-risk lesions. And it showed that after a diagnosis of atypical lobular hyperplasia, 15.4% of patients went on to develop breast cancer within 10 years. The ALH did not turn into cancer, and patients saw an increase in the risk for a future breast cancer in other parts of the breast as well as the other breast after a diagnosis of ALH. Having this diagnosis tells us that your breast can make abnormal cells anywhere in either of the breasts. The American Society of Breast Surgeons no longer recommends removing ALH because it doesn't change the fact that the breast can make these atypical and abnormal cells. So now the recommendation after this diagnosis is to consult with a high-risk breast clinic and consider increasing breast cancer surveillance with imaging such as MRIs, and consider taking medications like tamoxifen, which can decrease lifetime breast cancer risk.